Right, you are welcome to this very video. My name is Lucky O Igedose, PhD PL. I am a healthcare administrator as well as a legal practitioner. The topic I'm about to discuss is pulled from the book Ecological Principles and Strategic Planning in Modern Healthcare Practice, as you can see it on your screen. It was written by me to address a number of issues in healthcare management practice. So now, in the first place, the title of the topic is career pathways for healthcare and hospital administrators. Let's start take an overview of what it is about. Healthcare administrators manage the operations of healthcare facilities. They work in public and private hospitals, clinics, and health organizations. Their core duties consist of budgeting, staff management, policy development, and of course, regulatory compliance. It might be more than that. So they have specific job placements, such as one, they can be placed as health administrator or hospital manager. In this job placement, they manage overall hospital operations. That is the day-to-day operations of the hospital. They can work with clinical staff and even serve on the board of management of such hospitals, either as secretary to the board or even as active member of the board. Of course, they are involved in planning, budgeting, and policy implementation. All these are well discussed in the book that I earlier have showed you. Also, in every of these job role where they may find themselves, there are associated hazards as a hospital administrator or healthcare manager. And also there are associated rewards. One of the rewards is that they can occupy leadership position. They earn good remuneration, and of course, they can make good public health impacts. Aside this, there are hazards such as high stress associated with the job role, long working hours, legal and regulatory risks. That is why a healthcare administrator must be very knowledgeable in various aspects of human endeavor. Besides, they can work as clinic or ward managers. In this job role, they oversee daily clinic or ward operations. They manage patient scheduling, billing, and of course, they equally have to manage staff. So also, they can come in common contact with outpatients and even patients in specialized clinics. So as a clinic or ward manager, the healthcare administrator must be able to be knowledgeable and have good human relations. So in this role, there are associated rewards as well as hazards. One of the rewards is they enjoy better work-life balance, direct patient impacts, because since they are present in the ward as ward manager, they have that contact that the healthcare administrator working in other area may not have such contacts. And also, they have the benefit of career growth. But there are related and associated hazards in this job role. In this connection, you see there may be limited resources, high patient volume, that may result in burnout and, of course, daily challenges. A healthcare administrator or hospital manager can also be engaged as nursing home administrator, where people that are aged may be cared for. And in this job role, they manage long-term care facilities. They ensure quality care for the elderly as well as the vulnerable persons. And also, they have to maintain um, compliance with care regulations. Of course, this job role is associated with rewards as well as hazards. And in this case, they can be rewarded with job security. They enjoy diverse responsibilities of doing their work so that the incident of monotony will not set in, and they enjoy quality of life impacts. Of course, there are hazards such as emotional strain, strict regulations, and also staff shortages. A healthcare administrator, well trained, can also be a health information manager. In this role, they perform patient data and medical records management. They ensure data accuracy, security, and confidentiality. And of course, they play a key role in digital healthcare management systems, which of course is assuming a lot of currency in our present day. This job role also have its own rewards as well as associated hazards. In terms of reward, there is high demand. The role is often tech driven, and also they can enjoy some level of flexible career options. And besides besides that, besides that, there are hazards such as data security risk, because this era of digitalization can also expose data to unauthorized person, maybe by hacking the system if it is not well protected. Also, there are issues of regulatory body and, of course, limited patient interaction, because they may not come in very close contact with patient too often, in as much as they have taken care of the patient's record. And eventually, if it is purely electronic in nature, they may not even need to have personal contact with patients. Of course, a healthcare administrator can also be trained as being able to update itself to a level that can become a healthcare consultant. And in this role, they can provide expert advice on healthcare management and also formulation of policy and implementation of same. Also, somebody in this role can work with hospitals, non-governmental organizations that are healthcare related, as well as the government. And of course, he or she may be self-employed or firm-based. So, what are the rewards and hazards as a healthcare consultant? Reward may be there is high earning potential in this job role. Also, there is flexibility of work, because sometimes you define how you respond and how you do your work. And you can have the benefit of handling diverse projects all at the same time. But in terms of hazards, there may be income instability. You may have to travel frequently, even when you do not want to do so. And also, there is high performance pressure because of timeline that may be given to you to keep with and deliver within that stated period of time. Another area where a healthcare administrator can be employed is that he can take the role of a healthcare finance manager. Of course, he is not a trained accountant to say he's take care of the financing management in total, but he has what is referred to as oversight function over the financial operations of his or her healthcare establishment and should be able to interpret financial reports when he is called upon to do so. He can handle budgeting, billing, and also, like I said before, financial reporting and interpretation of sale. And a healthcare finance manager in this role ensures financial sustainability of the facility in which he finds himself or herself. There are quite a number of rewards associated with this job role. One is um, a healthcare manager in this role earn a competitive salary. He has strategic influence and, of course, career development. In terms of hazards, he may face economic pressures, compliance with complexity in terms of regulations, financial regulation, and so on, and often may be confronted with stressful workloads. Again, somebody who is trained in healthcare administration or hospital management can be employed as a public health administrator. In this role, he manages population health programs, works in government, NGO, and of course, in community health organizations. Also, he can focus on prevention and health care promotion. He may not be involved or he should not be involved in prescription of drugs or even diagnosis, but there are some health education he could carry out in order to promote public health. There are rewards as well as hazards associated with this role. In terms of reward, we can make a lot of social impact, we can have job satisfaction, stable employment. And in terms of hazard, there may be funding challenges because the money may not always be there. The issue of bureaucracy can make his hands to be tight. And also, there will be a lot of crises at times that he has to manage, which of course he has to be specialized in crisis management. And finally, a healthcare administrator can become an entrepreneur in medical equipment. And this involves sales, distribution, leasing, and consulting in terms of medical equipment or consumables. Of course, administrators apply management and policy knowledge in so many areas. And in this role as an entrepreneur, you can collaborate with biomedical engineers. So there are revision questions that you may come across, and I'm using this opportunity to invite you to have a copy of this book. You can see my WhatsApp there. You can send me a WhatsApp message on that number you are seeing on the screen, or you can click on the link and buy a copy of this very important book. Thank you very much and God bless.